One of the things that I think is common throughout all my clients is the fact that a lot of them feel like there's no hope, that they're lost, that they don't have a part in this community. And to be honest, I felt like all those things.
I became a caregiver at 8 years old. So I was in the helping professions from the time I was 8 years old, taking care of an alcoholic mother. So I've had plenty of experience in the helping professions. I went into nursing a little later in life, actually, at about 30. It wasn't until later in life I realized, I was struggling with anxiety. I was struggling with depression and anxiety.
Everyone has gone through something in their life that has left them depressed or had a hard time getting out of bed. I mean, we can all sit here and just talk for hours about different times in our life where we felt like we were just low or depressed or just fearful.
Jennifer, come on. Of all the things that I hold the most important and dear in my life is my connection with my mental health navigator, Kat.
So the word navigator, I think, is perfect for this position because it is somewhat like someone walking a path maybe on a mountainside that they've never been on before, and there's lots of challenges, but there's also some beauty and some things you can gain along the way. And so what you want when you're going on that path is someone not only who has already experienced it and been down that path, but has also studied the map. And I think that's an important thing about our behavioral health navigators is that they're people with lived experience and they bring that lived experience, but they've also received a tremendous amount of training as far as how to do the job, the best practices of the job. One of the first programs, if not the first new program that was funded by Mental Health Services Act at TEMA was a peer advocate. And John Byers played that role. He was a wellness center member. When the position opened up, he said, this is for me. This is what I've been looking for, and this is basically what I do at the centers with other people. Every day when I go to groups, I help them out. From that time, seeing the power of the work and the efficacy of the work that John did, and then the state embracing peer services more, we were able to build additional programs. Basically take that model of what John did and apply it in different settings.
I learned the term healthcare delivery system in 1982 at a class at San Francisco State University, navigating the healthcare delivery system. And this was Dr. Briney talking about how difficult it was 4 decades ago. There's not much that has changed in the mental health care delivery system, where it seems like my clients are constantly saying, Tony, I'm tired of doing an intake. Everywhere I go, there's another intake to do, and there's another line to get into. Can you help me, okay? Can you simplify this for me?
The paperwork is, I think, one of the biggest intimidation things for clients because it's literally putting your life on a piece of paper. And you're trying to explain how you're feeling, you're trying to explain why you're there, and on top of it, remembering their social securities, their insurance, all that stuff is even daunting to me. I always tell my clients, like, are you anxious? Because I get anxious when I do these things. And they're like, yeah. And I'm like, yeah, paperwork sucks for me too.
One of the things I really needed from Kat was help with motivating me to get to my appointments and not letting them go, because I was very good at missing appointments. And also sometimes taking the bus just wasn't an option, and every day from day to day I never know where I'm going to be at pain-wise, and that's what she did. She said, I can take you, and I'm like, what?
Our behavioral health navigation team really embraces the whatever it takes approach. And I think it's mainly because systems often fail. And when systems fail, it's the people who are doing the work, and it's not just our team, but many of the teams within our county that can actually break through and have a solution and help someone move forward.
Well, let me go down social services with you. Let me be your advocate. Let me get on the phone with managed care with you. We'll put it on the speaker if that's your if I got permission, and then we'll go through that, okay? And I can honestly say that you're not going to get the housing you're talking about. That's not going to happen today or tomorrow or next week. The therapy that you're looking for, that you've been searching for, not going to happen today or tomorrow, but we can get a timeline at least on when these things can happen.
It's empowering. You guys have a very, I don't know how you hire these people. You must have somebody that's got a really good intuitive ability to pick up who's right for this job.
I think the main thing that we look for is for that peer experience, and to really kind of own your experience and say, like, you know, this is, yeah, I have experience with mental health. This is kind of what I went through, and this is how I'm working on it. And I think the basic understanding that recovery is not a destination, but rather recovery is the journey. You know, there's no end spot. I'm fully recovered, yay, I get to go home now. No, it's all about, it's those day-to-day choices that you make. We deal a lot with people who are waiting from, they've just had that intake where they've shared everything and now they're waiting to see if they get into county services. And it's a waiting game. I mean, you're waiting for at least up to a week sometimes, and that's can be kind of daunting.
I have clients that have great days, I have clients who have bad days, but something that's consistent is me reaching out to them. And there's nothing like hearing a client say, oh my God, thank you for calling me today.
And more importantly, maybe most importantly, here's my card and my number, okay? I'm not going, we're a part of this now. We're a team. You're going to be calling me to get updates, and I'm going to be doing the same to you.
She's like, I'm always here for you, Jennifer. And trust is a big thing. So I have realized now, hindsight is 2020, that was what it was. That's why I don't reach out to people, because I don't trust, you know, that there isn't going to be some sudden shift or some sudden change in their personality towards me or whatever. That's part of the disease, you know, like we're just waiting for the other shoe to drop, you know. And that didn't happen with her.
We are all walking through life with backpacks filled with depression or anxiety that can be reminiscent of your college textbooks, you know, how heavy they are. And people see us struggling, and I think that's this peer support right there, is people see us struggling and they want to help and they ask us, and then you're like, no. But then when you accept that help, oh man, is it just so much easier to get around campus? Is it so much easier to open that library door?